Hi, welcome to another episode. Today I would be continuing with my series of talks on tracheostomy. So in the previous video I did talk about the surgical procedure, the indications of tracheostomy. Now many a times when we kind of communicate with the patient, bystanders or relatives, one of the commonly asked questions is it something that has to be there lifelong, or would you be able to remove the tracheostomy tube at some point? Yes, in majority of the cases we can decannulate the patient, in the sense as the primary condition improves. For example, in a patient who has COPD, as the condition of the chest improves, as the oxygen levels pick up, we can generally decannulate or remove the tracheostomy tube. Similarly, if it is done for an acute emergency, if the primary cause is treated, you could definitely remove the tracheostomy tube. A patient in ICU, if the patient does not require ventilatory support anymore, if the patient is able to maintain oxygen levels, breathing spontaneously, we can definitely consider removing the tracheostomy tubes. Now there are certain indications where the tracheostomy may have to be permanent. So these are generally in a subset of patients with malignancies or following oncological surgeries. So in general, if you see, majority of the patients, we are able to decannulate these patients. So this is something which the patient bystanders often have in mind, because when we counsel them about tracheostomy, many of them are not willing to give the consent for a tracheostomy, thinking that this is something that has to be there lifelong. However, what we need to understand is the fact that a tracheostomy done earlier has its own share of advantages. The recovery is generally much more quicker. The complications that can arise from prolonged intubation can be minimized with early tracheostomies. For more information, please continue watching our videos. Thank you.